Hi friends, I am Sundar. In this video, we are going to see about substance-related addictive disorder. Substance-induced disorder. In substance-induced disorder includes the medical condition that is directly caused by use of substance. This condition includes intoxication with drugs such as substance-induced delirium, substance-induced psychosis, and substance-induced mood disorder. Next, alcoholism. Alcoholism is defined as alcohol seeking or consumption of alcohol that are harmful to our health. Alcoholism is also known as alcohol use disorder. It is a broad term used for drinking all kinds of alcohol, which cause that result in the mental and physical problems. This disorder is now previously divided into two types: alcohol abuse and alcohol dependence. Next, cause of alcoholism. Mental health problem like anxiety, depressions, and bipolar disorder and other health problems increase the risk of alcoholism. It is easy to turn into alcohol when a person is depressed and anxious. Next, alcohol withdrawal state. Alcohol withdrawal state is a set of symptoms that occurs following the reduction in the use of alcohol after a period of excessive use. Symptoms typically includes anxiety, shakiness, sweating, and fast heartbeat, vomiting, and mild fever. Alcohol withdrawal symptoms occurs those who are alcohol dependent.
Caffeine is a central nervous system stimulus of the withdrawal class. It is the world's most widely consumed psychoactive drug. Unlike many other psychoactive substances, it is legal and unregular in nearly all parts of the world. There are several known mechanisms of active to explain the effects of caffeine. Formula C8, H10, N4 and O2. Caffeine intoxication. The May Clinic states that consuming more than 500 to 600 milligram of caffeine a day may lead to insomnia, nervousness, restlessness, irritability, and upset stomach, a fast headache, and even muscle tremors. However, previous research has linked every moderate amounts of caffeine to negative heart effects. To put that into context, an cup of coffee contains 80 to 175 milligram of caffeine depending on the bean and preparation method. Symptoms of caffeine: jitters, restlessness, nervousness, increase in heartbeat, nausea, anxiety, heart palpitation, insomnia, sweating, dizziness. Cannabis use disorders is the continued use of cannabis despite clinically significant distress or impairment. Cannabis use disorder is defined in the 5th reason of the Diagnostic and Statistic Manual of Mental Disorder and the ICD-10 publishment by World Health Organization as the continued use of cannabis despite clinically significant impairment ranging from mild of surf. Cannabis is one of the most widely used drugs. Other cannabis-induced disorder. Cannabis induced psychotic disorder. Cannabis-induced
Hallucinogen. It is a psychotic agent can cause hallucination. Commonly type of hallucination are the psychotic, dissociation and delirium causes. Drug that can alter feeling and thought. Hallucination that seem real thought or not. It also causes user to feel out control, scatter from the body. Symptoms of hallucinations: dilated pupil, salivation, tingling fingers, weakness, mood swing, anxiety, depression and paranoia. Treatment: hallucination drugs help them deal with stress, more enlightenment, sense of thinking and being. The abuser safely from the drugs, improve physical, emotional, mental health.
I am just going to talk about sedative, hypnotic or anxiolytic intoxication. Sedative, hypnotic or anxiolytic intoxication is characterized by a significant behavioral change. These include aggression, mood swing, and impaired judgment. The disintegration effects of this drug is similar to alcohol. Opioid use disorder. Opioid use disorder is a mental conditional change characterized by a problematic pattern of opioid use that causes clinical significance, impairment or distress. It often includes a strong desire to use opioids, increased tolerance to opioids, and withdrawal syndrome when opioids are abruptly discontinued. Opioid intoxication. Opioid addiction and opioid intoxication is a condition caused by use of opioid-based drugs, which includes morphine, heroin, oxycodone, and the synthetic opioid narcotics. Prescription opioids are used to treat pain, intoxication, or overdose. Can lead to a loss of alertness or unconsciousness.
So class, today we are going to discuss about opioid use disorder and stimulant disorder. First of all, I am going to say about opioids. What is opioid? Opioid is a substance that acts on a opioid receptor to produce morphine-like effects. Medically, they are primarily used for pain relief, including anesthesia. Now I am going to discuss about the side effects of opioids. So the side effects are itchiness, sedation, nausea, respiratory depression, constipation, and euphoria. Now I am moving on to intoxication, a condition caused by use of opioid-based drugs which include morphine, heroin, oxycodone, and the synthetic opioid narcotics. These are the intoxications. And above this, the prescription opioid are used to treat pain. So now I am going to say about stimulants. What are stimulants? Stimulants are a wide range of drugs such as amphetamines, methamphetamines, and cocaine. Stimulant-related disorder include stimulant intoxication, stimulant use disorder, and stimulant withdrawal. So, stimulant-related disorder or SRD continues to be an important public health problem for which there are presently no approved pharmacotherapies. So now I am going to say about stimulant withdrawals. So the stimulant withdrawals are such as heavy users may also experience hallucination, paranoia, and panic, and it lasts for about 7 days. And towards the end of the week, most symptoms begin to subside, but drug cravings become more intense. Extreme fatigue and severe depression may also present. So prescription opioids are used to treat pain, and overdose can lead to a loss of alertness or unconsciousness. So now I am going to speak about the withdrawal symptoms. So the withdrawal symptoms of opioids are nausea, muscle cramping, depression, agitation, anxiety, opiate, carving, sweats,
Effects of stimulant intoxication. Toxic level of stimulant excitation can result in heart attack, stroke, cirrhosis. It is an uncontrolled electrical activity in the brain or even fatal overheating. This viscous effects of prescription stimulants. This amphetamine-like substance that causes the same type of its effects of the body. It forms speed, loss of appetite, insomnia, increased heart rate. The abuse of this drug is larger doses, especially through injection or sporting, puts an even greater stains on the body. Next is symptoms of stimulant intoxication. First is dizziness, trauma, skin flushing. It is a redness of the typical skin near the eyes and the cheek. Palpitation, cardiac arrhythmias. It is a group of a condition in which unnormal heartbeat and cramps and sweatings, confusion, hallucination, panic, hypertension, vomiting, hospitality. Treatment for stimulant disorder. Treatment for similar disorder use supply substance that may cause a disorder treatment, provide with vital information on the effects of stimulant abuse, and this describes treatment approaches that are appropriate and effective for treating. Researchers now believe that these impairment under the cognitive defect that are often seen in chronic stimulant users. Effective treatment statistic must recognize the impact that the stimulant abuse and dependence have on the user's ability to respond to treatment.
Hello friends, today I'm gonna discuss about the topic of smoking and its causes. We all know that smoking causes cancer and other heart disease, but the things that we don't know or the people out there were not concerned of these topics are gonna discuss right now. So, cigarette smoking is the leading preventable cause of death in the United States as well as in the world. Smoking causes more than 480,000 deaths each year, and the saddest part is smoking causes more deaths than any other death cause like HIV, alcohol use, illegal drug use, or motor vehicle injuries like that. So, the more than 10 times in many US citizens have died prematurely from cigarette smoking. So, when we're going through smoking and increased health risks, are we all know that smokers are more likely than non-smokers to develop heart disease, stroke, and lung cancer. So estimates show smoking increases the risk for coronary heart disease by 2 to 4 times, and for stroke by 2 to 4 times also, of men developing lung cancer by 25 times and women developing lung cancer by 25.7 times more. Smoking causes diminished overall health, increased from work, and increased healthcare utilization and cost. So when we're going to smoking and cardiovascular disease, smokers are great risk of disease that affect the heart and blood vessels. Smoking causes stroke and coronary heart disease, as I've said before, which are among the leading cause of death in the world. Even people who smoke fewer than 5 cigarettes a day can have earlier signs of cardiovascular diseases. Smoking and respiratory disease. Smoking can cause lung disease by damaging your airways and the small air sacs found in the lung. Lung disease caused by smoking, including COPD, which includes emphysema and chronic bronchitis. Cigarette smoking causes most cases of lung cancers. If you have asthma, tobacco smoke can trigger an attack or make an attack worse. Smokers are 12 to 13 times more likely to die from COPD than non-smokers. So when we are going to talk about smoking and cancer, we might be thinking that smoking only causes cancer to our lungs and as well as our mouth part. So it's true, and it's not fully true because there are some other organs are still be affected by smoking. So smoking can cause cancer almost anywhere in our body, like bladder, blood, esophagus, kidney, liver, pancreas, stomach, etc., as well as trachea, bronchi, and lungs. So smoking is really bad for uh, all the organs, as we knew right now, and other health risks. Smoking harm nearly every organ of the body and affect the person overall health. Smoking can make it harder for a woman to become pregnant. It can also affect her baby health before and after birth. Smoking increased risk for stillbirth, death of the baby before birth, low birth weight, sudden infant death syndrome known as SIDS, like that. So the saddest part of smoking are this, that the people out there will not be knowing about these things. So it can also affect men's sperm, which can reduce fertility and also increase risk of birth defect. Smoking affects the health of your teeth and gum and can cause teeth loss. Quitting and reduce risk. Quitting smoking cuts cardiovascular risk. Just 1 year after quitting smoking, your risk of heart attack drops sharply. Within 2 to 5 years quitting smoking, your risk for stroke may reduce to about that of non-smoker. If you quit smoking, your risk of cancer of the mouth, throat, esophagus, and bladder drop by half within 5 years. And 10 years after you quitting smoking, your risk of lung cancer